Hello and welcome back to part 2 of staying healthy and preventing COVID 19 infections during the current pandemic. Why social distance of 2 meters may not work will be discussing today. Imposing social distances are essential, but nevertheless, it's not the only part of action that should be taken to prevent diseases. Since COVID 19 spreads mostly via air, as we discussed in the previous video, through aerosolized particles, people can get infected from further away than 2 meters. In fact, many of these people may not have no clue how they got it. For example, they may deny of having any close contact with a person with COVID 19 or someone vigorously coughing. It is contaminated air that passes the virus to people most commonly. People who contract the disease sitting 20 to 30 feet away from a patient, for example, while traveling in the public bus, as happened in China, is a good example of this mode of spreading the virus. This new concept has serious repercussions. In addition, the virus can thrive in cold, damp situations, including in air conditioning systems. So the absence of installed HEPA filters, as we discussed in the previous video, the majority of air conditioning systems in the world indeed can spread COVID-19 virus across an entire building, exposing thousands or hundreds of people staying far away. Irrespective of the way of achieving social distancing, the gold standard, as we were told, 2 meters away from the infected person, unlikely to prevent others. This is a classic narrow-minded view of putting all eggs in one basket to protect them. However, that does not mean imposing social distancing is less important. For it to be successful, however, it must be combined with several other cost-effective public health principles and preventative actions. Unfortunately, this is not happening in most countries. This will be discussed in details in another video. Nevertheless, it is essential that all countries to work diligently and in cooperation, including sharing information and taking the effective measures to control and eliminate the COVID-19 epidemic earliest possible. Another aspect to worry about is a premature release of people from quarantine centers. The only way to prevent this is to test people prior to their discharge. It is common sense. For example, after the day 10, if they haven't had the disease or manifestation of clinical signs, they are almost always likely to have positive test results, depending on the sensitivity of the assay health workers are using. Those who are negative, however, should be retested in another 1 or 2 days later, certainly prior to their discharge. The next concern is the premature relaxation of social distancing regulation by various local and central governments. The latter includes opening up beaches, gymnasiums and pubs, and any place of gatherings. Such can add yet another dimension to the ongoing disaster, and in fact, it is asking for trouble. For example, China opted to do it a couple of days ago, and thousands of people gathered at the beaches. Similar thing happening in Florida, Carolina, and in California, and God help them. Relaxation of social distancing must be based on analysis of real-time data and related to geographic information system, and must be implemented gradually, one sector at a time, while collecting the real-time data on any outbreaks. Let's look at the key successful ingredient in controlling this epidemic. The success mostly depending on early identification of the affected by testing, humane, effective quarantining, contact tracing, and taking affirmative steps to prevent dissemination of the disease, not by locking down provinces or the country or enforcing curfews alone. These success factors include extensive testing, blood and throat swabs testing in and out of hospital, effective surveillance, firm action on social distancing, public education, implementing strict hygienic measures, effective and diligent contact tracing and indeed testing, and finally humane quarantine to prevent further spread. Finally, the most important is to apply the principle that we learned from 2002 SARS epidemic crisis and not listen to the theoretical pundits who preaching in the West. Following the above made it easier for these Eastern leaders to implement a tailor-made package of items simultaneously, not relying on one specific thing. This is what other countries should follow, rather than blindly following the failed Western model, especially the Imperial College model. Mentioned Eastern countries had further advantages because of the previous experiences. They were prepared. Not only the government but also the public knew that what to do, and they were very cooperative and doing the right thing. As in Hong Kong and South Korea, wearing a face mask, for example, in public has become the norm. This was designed to protect themselves. So in the next video, I will discuss the key actions should be taken by any administration in all countries and how such affecting the clinical outcomes, an ingredient for success, and why Western countries uniformly fail to control the COVID epidemic. Please join for the next part 3 of this video series. Thank you.